Hi, Facebook Live. Been a couple of weeks since I've done this, so it's nice to be back in the saddle. Got some questions here, and as ever, if you are on watching this live and you have any questions, then feel free to just ask me directly, and I'll be very happy to try and answer it if I can. So we've got some questions about wearing the support bra, about blood transfusion, about going into the hydropool, and about alopecia, if it's going to make alopecia worse, having surgery. So when should I stop wearing the support bra, and when is it okay to go in the ocean after surgery? So the support bra, I normally say, is I use a support bra for all of my breast operations. Breast augmentation, the support bra goes on straight away. If you have a breast lift or a breast reduction, then I put tape on for the first week, and then after the first week then you wear the support bra. And I normally say day and night for the support bra for a month. If you have teardrop implants, particularly teardrop silicone implants, then I say 6 weeks for the support bra, day and night, simply because there's more risk. Well, there's risk of rotation of teardrop implants, not more risk. Doesn't matter if a round implant rotates, whereas if a teardrop implant rotates, the shape changes. So it's more important that the pocket is secure with a teardrop implant. So I say 6 weeks for a support bra, day and night for teardrop, 4 weeks for a round implant. Polyurethane implants are much less likely to rotate, so with a teardrop polyurethane implant, then 4 weeks is okay. After that, then you can start not wearing a support bra, particularly in this weather, because it's such a nice, it's such nice weather. So you might want to get out of that support bra. So after 4 weeks, get into a normal bra, but it might irritate the scar. So just play it by ear and see how it goes. If it irritates the scar, then go back to the support bra. If I keep talking, then perhaps you won't hear my children in the background. The ocean, well, more commonly is asked, is a swimming pool. So a swimming pool is, well, what I do is I take the dressings off after a week, then give you some gauze to wear in the bra, and then after the first day or two after the dressing comes off, then you look at the gauze. If the gauze got nothing on it, then you can you don't need any dressing. If the gauze has got something on it, like a little spot of blood or anything, then you can wear a then you need to put another piece of gauze in, but it's normally for the first couple of days after having the dressing removed. You might need a little bit of gauze in your bra. While there is something on the gauze, then you should avoid going into the swimming pool, because you've sort of got an open wound, really. But it's usually just for a couple of days after that, the first week. So I'd say 2 weeks you can go back into the swimming pool. The sea is actually better. The sea, you can go into the sea, even if there was a little bit of a ooze on the dressing. You could go into the sea. The sea's pretty good for wounds, actually. It's like when the airmen who used to get shot down in the aeroplane, if they landed and burnt badly, if they landed in the sea, they did a lot better because of the salt water. So sea's pretty good for wounds. So go to the sea even sooner than that. But 2 weeks is fine for the sea or the swimming pool. The issue with not having blood transfusions, we occasionally have patients who don't want a blood transfusion, and so the first thing is just to mention that preoperatively, and we can usually accommodate that, and that's absolutely fine. There's very few operations where I would need a blood transfusion, to be honest. Certainly the operations that I do. Big breast reductions and bigger tummy tucks are ones where you might consider having a blood transfusion. Usually if you did need a blood transfusion after that sort of surgery, it would usually be in the days after the surgery when you're feeling a bit weak and wobbly, check your blood counts a little bit low. You might say, look, you feel better if you have a blood transfusion, but you might say, look, I don't want one, and we say, okay, fine, it's going to take a while for the blood count to come up on its own. Plenty of fresh fruit and veg, etc. Have a good diet, and it should be fine. It would be very rare to need to have a blood transfusion during surgery. It certainly never happened to me, but it's something that we would have to consider. What would we do if there was a sort of life-threatening situation during the surgery? Would you accept a blood transfusion or not? Because that's something important to clarify prior. to having the surgery. But the usual situation is that you wouldn't need a blood transfusion for any of the any cosmetic surgery. As I say, bigger breast reductions and bigger tummy tucks is a possibility, but that would usually be in the post-operative period, so we could have a discussion about that, whether that will be a good thing to do or not. But the bottom line is bring it up with the surgeon pre-operatively and have a discussion about that. Can you go into a hydropool 3 weeks after a breast augmentation? I don't know what a hydropool is. Is it like I guess it's like those things that they sell in the garden centre. Is it like a jacuzzi? Anyway, I think it's the same as a swimming pool, really. And so as long as the wounds, 3 weeks after the breast augmentation, the wounds, you should not be needing any more gauze in your bra. The wounds, I'm sure, are dry. This is Salwa asking this. Hello, Salwa. So the wounds will be dry, and yeah, you can go into a hydro pool. I'm guessing it's not like a high pressure like jet, like a fire engine thing. Hydro pool? No, can't believe it is that. If it is that, then I think 3 weeks is a bit soon for anything too sort of traumatic against the breast. There will still be swelling at 3 weeks, about 6 weeks before the swelling settles and before you be doing any too much activities with your upper arms. But if it's just gently sitting in a pool with water, which what hydro pool sounds like, maybe a bit of some gentle jets, that should be absolutely fine. If you want me to clarify that, Salwa, I think I'm seeing you soon, but we can talk about it offline, if you like, or online, email me. Shantae's asking, is surgery likely to flare conditions such as alopecia? Now, I think you said that your alopecia comes when you get stressed. That precipitates the alopecia, and surgery is a stressful event. Any surgery is a stressful event. I've got to say, breast augmentation, is it breast augmentation you think you're having? Any sort of breast or body recontouring surgery is even more stressful than most surgery, because not only do you have the stress of the surgery, like the physical stress of having an operation to your body, there's also an emotional time, and it can be stressful because things can look unusual to start with. They often don't look perfect to start with. Things are swollen, you can get some asymmetries and things, and it takes a good few months for things to settle down. So the answer is yes. If your condition is brought on by stress, then having breast or body contouring surgery may bring the condition on. The thing to do is to be as forewarned as possible about what sort of results you can achieve when you come to the clinic. I don't think you've been to the clinic yet, but if you come, I'll show you some photos of patients who are early post-op to show that things are often a bit swollen, don't look quite right in the early post-operative period. So as long as you're forewarned about that and prepared for that, then that will mitigate the problems. But I think if you do have a problem that is precipitated by stress, having surgery might bring that on. And again, just be aware of that and decide whether it's okay to have surgery or not. The other thing is, if there's a doctor looking after your alopecia, speak to them about it and see what they think. And if it's really sensitive to stress, then maybe you should consider not having surgery, or we could talk about it and see whether we could get you into a position where you feel comfortable going ahead with surgery and maybe accepting that it might flare up your condition, possibly. I've also had an inquiry today, which is not on the list here, but it was about a patient who's got a problem with the platelets, who wants to have surgery, and they've been fine with their doctor who's looking after platelets, says it's fine. That's what I would do. If someone's got a problem with their platelets or with their bloods, with their blood clotting, or any problems like that, then I would say, who's looking after that? The haematologist or the GP, and then I would liaise with them and speak to them. And first of all, I'd say the first thing to say is the condition optimized? So is it as good as it can be? Is there anything they can do? Is there any medication or anything they can do to actually make the condition better? If there is anything they can do to make the condition better, then we should postpone surgery until you've finished your course of treatment, or they've done whatever they can do to optimize your condition. If your condition is as good as it's going to be and you're going to be like this forever, then we make a decision with the doctors looking after your blood problem as to whether a surgery is the right thing to do. And if it's something like a blood clotting problem, then we'd say, look, you're at increased risk of bleeding, more chance of bleeding, hematoma, and do we, first of all, is there anything we can do to mitigate that risk? I mean, we do everything we can already to reduce that risk. If there was something more we could do, we would do that for everybody. So the the answer is we just have a discussion, say, look, you're an increased risk of hematoma, maybe we would carry on and just do it anyway, or maybe we would think about not, it wouldn't be worth the risk, and therefore maybe you shouldn't have the surgery. But it's something for discussion. But it's not a no-no, and certainly since your hematologist says it's fine, then it's absolutely fine with me to go ahead with your platelets are a bit low. Got through it there, so that's good. I hope you didn't hear everyone arguing in the background like I could. I think this earpiece will hopefully not allow that, and therefore I shouldn't have probably mentioned it. So that's me. I'm done. It's a beautiful day out there. I am going to go and see what's happening in the arguments in the other room. And if you have any questions, if you've asked them while I'm here, because that happened last time and I didn't see them, I thought I'd sorted that out, and I think I have got the thing that I can see. But anyway, if you are asking any questions right now and I'm not seeing them, I'm sorry. I will answer them directly in the chat, and I'll talk about them next week if you like. But if you do, if you're not seeing this live and you want to ask questions, just email Laura at staianoplasticsurgery.co.uk, and she will let me know, and I will answer them next week. So signing off. Have a lovely evening. It's a beautiful, beautiful evening by the looks of it, in between the rain, and I will catch you then.